In this month's Patreon exclusive video, we will have a look at a finding which is not very common, and still I've seen this a few times. And initially when I saw it the first time, I was a little bit confused, and I did some digging and came up with this wonderful paper that we will also have a look at here. And potentially you have seen this yourself already. Now, I'm talking about this finding here. So this patient had a fall on the wrist and pain, ongoing pain for quite some time. And basically what it is a occult distal radial fracture, non-displaced. That's the reason why this person has pain. Now, this is not the interesting finding, obviously. Now let's zoom in here in this T1 weighted sequence. And if you look closely, we can see the fracture going through here. So that's the easy part. But what about these hyperintense findings? So we have these little dots here a larger one, there, that are just along the path of the fracture. And what this actually is, we can also have a look at the fat saturated proton density weighted sequence here. Let's zoom in a little, and we then do just a little correlation. So we can go here, we can see in the fat suppressed image, this is actually, wait a minute. So in the fat suppressed images, this one here is hypointense, same is true here, this dot here. So this is actually fat. So we have fat within the bone, and it's nothing new, we know this, we have the fatty bone marrow, but this is something that looks like fat globules, and this can actually happen. So it's called sometimes the fat globule sign, which can also be seen in osteomyelitis, but not exclusively. So we can also see this sometimes with bone bruising or fractures, that we have the bone releasing fat globules, basically due to necrosis of marrow fat cells or whatever the pathophysiology is. But if you see something like this, this is suggestive of a fracture or fat globules that are released due to the trauma. We know that the fat can also be released inside the joint. We all know the FBI sign in the knee, etc. But this is just a nice example of something like that. Now let's move on to the paper. So, and this is the article that I found when I saw this the first time, and you can see it's in Skeletal Radiology, pretty recent, well, 2014, it's been a few years already, and it's by the group of Resnick, so a very good article. And they write here, the intramedullary fat globules related to bone trauma, a new MR imaging finding. So at that time, this was not described previously. It was just known to be there with osteomyelitis. Now, they looked at a lot of cases, and with this trauma, basically just, I think it was the knee MRI, and in up to 2% of patients after acute or subacute knee injury, they saw this fat globule sign. And I just have shown you an image of the wrist and not the knee. So they also say that the fat accumulation to trauma is well known and can lead to fat embolism, and that's nothing new. We have the release of fat into the joint, and here you can see this big fat globule here, and you have this hyperintense rim around it, so don't fall for like metastasis or any other strange abnormalities. Here a lot of tiny little fat globules that have been released, very nice. Also here, and very interesting, and they say this also in the paper, that these fat globules can be quite distant, or well, the distance between the trauma here, the level of the knee, and these fat globules can be quite high, so even up to 6 centimeters from the site of trauma in that study here. Very interesting to keep in mind. And here the discussion again, main finding, up to 2% had this, and interestingly enough, if these fat globules were present, generally these patients were a little bit older, and one hypothesis is that we have more fatty marrow and less trabecular bone, so we have bone loss with age, and this potential space can easily be filled up with this fat globule. So that's one of the hypotheses why we see this a little bit more frequently in older patients. Here's just another nice example. Well, I attached you the paper, you can go and have a look at it, and it's not a really fancy topic this month, but I think it's still something that can be confusing if you haven't seen this before or if you don't know about it. So therefore I think it's important and can save you quite a lot of headache and time, or you can impress some of your colleagues next time you see this. As usual, thanks for all your support. You're really amazing and you are really keeping me motivated to go on with this mission here. And with that, see you next time.